Now I want to sort of talk about how we've talked about previously in health policy, about how local, federal, national, and then global actors in public health work together, but I'm sort of going to show you more about how that actually works. So one of the things is we look at different roles. So the State Department, the state health departments, they actually look at collecting statistics. Again, almost every one of these entities is collecting that information, which helps us make those better decisions. So it's collecting incidences of accidents and injuries and illness and new risk factors and water and all that kind of stuff so that we can make better decisions. And they're sending it all to the CDC after they send it to the state. So it's got, each one of those levels has got a capacity to collect data to feed back into the system. They're administering interventions and preventions, the local health departments, so they are licensing health people. They are making sure that the labs that measure water quality are working well. They're also regulating health facilities, licensure of doctors. They're also making sure that your water is good, your environment is good. They're also doing sort of medical examinations, so they're seeing why people are dying, they're capturing incidences rates. Local health departments might be providing things like immunizations for people who can't afford them. They might be looking at initial investigations of outbreaks. So local health departments in Flint were going, what's going on here? Or they should have been, based on what the doctor's telling them. They might also be delivering some programs like tobacco cessation programs. They might also be doing disaster preparedness programs. So local people and national, state people are also kind of doing roles that's kind of intermix. But again, part of everything is collecting data and part of everything is implementing programs. One of the things to keep in mind, though, is that we also in the United States have other agencies and other places globally depending on us. So you have other government agencies like the EPA. Now that's doing environmental health, correct? And they're relying on that data that comes from those local and state level data collection entities of water quality and air quality and cancer incidences. So they're all relying on that information to feed up to that federal level and give it information so it can make health recommendations. It can see where's a Superfund that needs to be cleaned up, those kinds of things. Occupational safety is also looking for injuries, or one place is getting more injuries than the other. Where's hazardous exposure in the work site, right? Again, so that data collection is very important and feeds up to government agencies so that they can make decisions based upon your health and help implement policies or help come up with policies that can be implemented at the state and local level. The Department of Homeland Security is looking at where disasters happen, so that fire in California, earthquakes, tornadoes, all of those things are very quickly public health issues because no water, you can have all kinds of diseases, all kinds of things that happen. Again, they're looking at localities to collect that information, localities they're working with to implement those programs and implement those things to help people get better. When you've seen flooding, that's certainly going to have a lot of diseases that come about that weren't there before. Again, local officials working with Homeland Security to address that. Department of Agriculture looks at the food supply. How safe is it? Again, the local people are saying, oh, we have incidents of food poisoning that's happening here. For instance, well, in lettuce, that was local and national and state level health departments telling the National Agriculture Department where this infection was coming from, the E. coli infection was coming from, and then communicating that to everybody who might be impacted. Another thing is housing and urban development. So they're looking at, is housing stock safe? Where is it at? Where are the environment impacting where people live? Again, that's the EPA and HUD. So again, a lot of these agencies are working together, but they're sharing information that has to be collected on the local and state level. Department of Energy is looking at how energy is impacting people, how access to electricity and or not is impacting people. One of the roles, though, that we need to think about, too, is that whenever we talk about globally, okay, so we've done our federal thing, and the CDC is also something that I should mention, and I mention almost every other video, and the Center for Disease Control, a little caveat, I've worked for them for a while, they collect data nationally from doctors, and they'll tell you where incidences are happening. So we knew about HIV/AIDS. It wasn't called that then, but we knew about it because we saw incidences of a weird disease pattern that usually happens in Italian men, and we saw lots of people getting very sick in specific locations. So they sent inspectors there to see, what is it about here? What's the data about here? Who are these people being impacted that are having all these cases? But again, that was the physician, local healthcare departments, saying there's an incident here, reporting to the CDC sending impact people, and those people trying to help work with the local, national, state, federal laboratories to figure out what's going on and to see where there might be people at risk, where there might be other clusters of this disease. So again, we have all these systems in place, this infrastructure in place to really provide that data so we can make all those decisions about how we have that impact and that implementation of policy and how we make sure that it's targeted to the communities where things are happening and who we do what to, or who we say, this is a problem, this is a solution, or what community we engage in helping come up with that solution. One of the things, though, is when we go outside, we also have what we call non-governmental actors. And again, some of them actually do rely on the health departments, the state health departments for whenever people come back and they have foreign diseases. But also they rely strongly on the CDC because the CDC has some of the most advanced laboratories and the National Institutes of Health. They also were part of figuring out about HIV/AIDS and that it was a virus. It was through the National Institutes of Health. So it's very important that all these agencies have a strong infrastructure and a strong data collection and data dissemination because they help impact our country's health, but they also impact the global health. Partially because health and health risks don't stay where they start, but they also, some of the solutions and some of the labs they depend on because their infrastructure in these other places is not that strong. One of the things the NGOs, non-governmental organizations, NGOs, I'll talk about is the American Red Cross. They certainly can have blood donations, so if there's a problem with a hurricane, earthquake, whatever, they can make sure there's enough blood for there. They also help with disaster preparedness and disaster response, again, in combination with the local and the state and the feds. When you talk globally, there are organizations like Doctors Without Borders and Physicians for Social Responsibility who are looking at not just delivering services, but also working on the policy end. So they're trying to help make sure that the policies that come about from our government or globally help the most people in the best way to make sure that the public health is at a minimum standard of good to worse, not, but better. There are also advocacy groups, sort of like the American Cancer Society, that make sure there's lots of cancer research going, but not just research, but also make sure that the policies and people who need this information get it and get the interventions that they need. They also help with public education. Again, that's part of public health. So we are with public health advocates for policy or public health people in general are very much working with not just the local communities, but with NGOs who can help deliver that technical assistance. They also can help work on behalf because sometimes we can't work with the government. So they can also work on our behalf to make sure that we give them the information they need to push for better policies, to make sure that everybody has access to a minimum standard of health and have better outcomes. Internationally, there are other organizations that really do play a strong role in making sure that public health is good for everyone. They could be places like CARE and Oxfam that advocate for global health. The Gates Foundation also does that. Some of these foundations also make sure that people have access to health care. So the Gates Foundation, some of the global entities, so the Global Fund, and another one is one that started here at PEPFAR that's from the America to other places that make sure that people have access to medicines, so they help deliver the capital that helps that to happen. The Global Fund makes sure that people have access to those things we called like barriers, so they have access to malaria nets, and those are sort of global consortiums. They're countries and they're NGOs working together to sort of provide the money that other organizations, other countries can't afford to make sure that these known solutions, interventions to public health issues, communicable diseases, non-communicable diseases are available to everybody no matter where they live. And some of that you could say is preventive, so we don't get it, which is great, but it also could be because we think everybody should have a certain standard of care, and if we know what prevents it, if money is the only obstacle, then we have to come up with a way to make sure that they get access to these things. Because if we know there's a way to make sure that children don't get diseases that kill them, and we're not working towards that, then do we really believe in public health for everybody, or do we just believe in public health just for us? And is that part of our role? Is that part of the standards that we want to have in the world? Is that part of our values? So that's something to think about when you think about health and public health, is what are our values? And how do we make sure that those values happen to everyone here? But it's not a here or there, it's everywhere. And again, you may have to sell that as we're making sure that whatever happens there doesn't come here. But if you have the value and you know how the world works or how it works, you can make sure that everyone has access to those values. You just have to be very creative and find a way to do that. And it's not just one way. It's not just data. It's not just an intervention. It's also making sure that you have a way to pay for that infrastructure. You don't just deliver medicine, but you deliver a way that we can build up their community health system. It may not be doctors. It might be community health workers. We make sure that we improve the quality of food for everyone, because that means everyone is healthier. We make sure that whether we have food deserts here, we make sure that they don't exist and that people have access to healthier foods and know how to use them. The same thing that we want to happen in other places in the world where we know that children have enough food, but not the right food at the right time. So there are lots of children who have what's called stunting, which is also, it's a developmental disability because it affects their brain when they're growing. So if we make sure that they have access to nutritious food, we will also have more people healthier everywhere, which will reduce their risk of getting communicable and non-communicable diseases, and will help them live to the standard and the level that all human beings should.